just the beginning.
Nurses in New South Wales want a better deal for their patients.
This is all about the people of New South Wales, this campaign.
We've had a record vote of branches. 214 branches have come out in support. Nurses in country hospitals like Goulburn simply cannot physically provide the same level of care to patients with the same illness as their city colleagues.
It is unfair that the ratios are different in the city than they are to here in country hospitals like Goulburn.
Every day people wonder how well were we able to care for our patients in our wards or in the community this week.
And we know you can't do it properly when there are not enough nurses or midwives for the patients in your care. When you run all shift from one patient to another, people waiting for pain relief, medication, help to change position, a bedpan, people in distress, people who don't understand why you've taken so long to get to them.
It's intolerable. Intolerable for them and intolerable for us.
A two-tier system where nurses are supported and staffed to provide first-rate care in some hospitals, mainly the cities, while their colleagues in others, mainly the country, are not, is unacceptable.
We want a better deal for the patients who are in emergency departments, who are in intensive care areas, who are in paediatric wards.
And let's not forget those patients in our community that are waiting for the care in their own homes or in crowded community health centres.
We need to see an improvement in the nursing hours and therefore the ratios here in places like Bathurst.
And we know that nurse to patient ratios delivered by mandated minimum nursing hours, maximum face-to-face hours for community nurses, enshrined in our legally enforceable award, is the only way to deliver safe care.
For somewhere like Muswellbrook, on a 20-bed medical ward, for example, compared to a 20-bed medical ward at one of the city hospitals, your patients are receiving 20 hours less per day.
Work in an under-resourced, understaffed clinical environment, unequal to our counterparts in the city.
We, as experienced and dedicated nurses at Kempsey, know we are struggling to keep our patients safe.
Maybe we really are tougher in the bush, but does that mean we are entitled to less care?
We need more nurses. We need more nurses in rural health. We need more nurses in mental health. We're trying to provide a sirloin steak service on a sausage budget.
And we've had enough. Nurse injury and burnout is increasing.
We're over and done with it, we're sick of it, and we want something done now.
The worst case scenario is that people die.
It's not fair and it's not safe.
We're nurses. We're passionate about our job.
I've always been proud to be a nurse and proud to work for your association, fighting for a better deal for nurses.
But I've never been prouder than in the past few weeks. When the government threw its paltry 2.5% pay offer on the table, other public sector workers told them what to do with it. But what did our members, the nurses and midwives in our public health system, do? They said, we need the money the same as everyone else to pay our bills and take care of our families, but there is something that is much more important to us. And that something is, we simply must have enough of us to give all New South Wales patients in all wards, in all New South Wales hospitals, the same world-class care they now get in just some hospitals.
We can be proud as nurses that we stand up for a better deal for the people of New South Wales.
And please make sure you make this campaign a topic of discussion with your colleagues, your family and your friends.
This is going to be a long and hard campaign. We're going to have to work for this, but it is worth working for.
That's why we cannot give up this fight or this campaign till we have won that care for everyone in New South Wales.
We need to press the New South Wales Government, and you'll have my 100% support.
Tell Mr O'Farrell that it's time to sort the problem out.
Mr O'Farrell, this is a simple claim. All the nurses are asking for is the chance to care for patients like we want to, and like patients deserve. We want to put patient safety first.